Um, right. Should I prepare on the... we all right? We good? How should I prepare on the night before and the day of my procedure? Main thing is positive mental attitude, PMA. Positive mental attitude, be positive, good night's sleep, don't get drunk. We had that once, someone came the next morning and they'd been drinking till the early hours, so we cancelled them. So don't get drunk the night before, don't come in hungover and smelling of alcohol. But yeah, have a good night's sleep, be positive, and the day of the procedure, yeah. Even if you're not having an overnight stay, it might be worth bringing overnight stuff just in case you don't feel very well and you need to stay overnight. Sometimes that can be a good idea, just to bring the stuff so it's there. Because worst case, just bring it home again. Make sure you've got a lift home, because oh god, I've got another question here. Oh, Rachel, what are you doing? What are you doing? Anyway, let me do this question first. No. I'm not looking. If I don't look, maybe it'll go away. How should I prepare on the night of before and the day of procedure? Yeah, day of procedure, be positive. Make sure someone's got to drive you home. If you come in the car, think how you're going to get your car back home again, stuff like that. Is that helpful? We give you a sheet with what to expect and all that sort of stuff. I think that's what's on it. Rachel Evans, what are you doing? What's Brasiliano safe abdominal liposuction? Also BSAL. Oh, good God. What's BSAL? Rachel, Brasiliano safe abdominal liposuction. Anyone? I don't know. I don't know. Right, here we go. Are you okay to have a couple of glasses of wine too? Right, I'm okay with that question, Rachel. I'm going to answer your second question first. And listen, Rachel, I don't know what Brasiliano safe abdominal liposuction is. BSAL. Don't know. It's a new one, is it, Rachel? Can I answer that one next week? Yeah, I'll answer that one next week, Rachel. Google, I have nothing to do with it. I'll get the knowledge, myself by next week. Are you okay to have a couple of glasses of wine 2 days after neck liposuction? Yes, Rachel, you are. That's absolutely fine. Yeah, I think everything in moderation. If you like a glass of wine, it's a stressful time. You're obviously not on, not at work and things. Yeah, absolutely fine. Yeah, no problem with that at all. Yeah, I can answer that question, and I'll look at Brasiliano safe abdominal liposuction. I'm thrown off now. Where am I? What should I expect immediately after surgery? Hold on a minute. What should I prepare on the night? Well, these are similar questions, aren't they? What should I look out for in the days and weeks following surgery? Oh dear, I've got a few samey questions here. Immediately after surgery, you'll wake up in the recovery room, so don't be alarmed if you don't wake. Well, if it's a general anaesthetic, that is at one of the hospitals. Don't be alarmed if you don't wake up at the in the room you were in before. You wake up in the recovery, which is an area within the theatre complex. You feel a bit groggy, you feel a bit, tired, a bit drowsy, and you go to the ward. Then you either stay overnight or go home later that day. It's difficult. I don't know. We're not talking about what sort of surgery here, but you will be a bit swollen. Everything will probably feel tight because most plastic surgery is making stuff tight. Most of the stuff we do is tightening things. So whatever part of the body, it's probably a good bet that things are going to feel pretty tight, pretty swollen, and pretty weird, tingling. The look will look strange if you do look at things. You might have dressings on, so you might not be able to see things, but if you do look at things, don't worry if they don't look how you expected them to look, because it takes a while for things to settle, and often we do things and make them a certain shape to start with, into knowing that they're going to settle into a different sort of shape. So don't think this is my long-term result at day one. Don't get upset if it's not how you thought it was going to be at day one. It often takes time for it to settle. Look out for the days and weeks following surgery. So looking out for, that's sort of more like complication things. Most complications in the days and weeks after surgery, we probably don't have to tell you to look out for them. If you get a complication, you'll know about it. It's not subtle. Particularly if you've had a bilateral procedure, so if you had an operation on two sides, like two breasts or something, if one's doing something and the one's not, that's a bit of a worry. If one's very painful, if the other one's not, if one's very swollen, one's very red, If they're both painful, swollen and red, it might be something, but it's less likely to be something. So look for something on one side, that's one thing. But anything out of the order, if you're worried about it, give us a ring. Come to the clinic, drop us a photo, take a photo of yourself, and keep in touch, because otherwise it's no good being worried at home. Problem shared is a problem halved. So get in touch, let us know. But the sort of things you're worried about is I suppose, swelling, redness, tenderness, discharge from the wound. If the dressings get wet, you might need to have them changed. These are the sort of things you look out for in the days and weeks after surgery.